Hello, friends, and thank you for joining me on the Finding Elevation podcast. I'm your host, Lisa Thompson. I am a mountaineer. I've coached hundreds of aspiring mountain athletes to reach their goals. I also am the author of the book, Finding Elevation, Fear and Courage on the World's Most Dangerous Mountain. And I am super passionate about learning and growing through adventurous pursuits. That's why this podcast is dedicated to encouraging, uplifting, inspiring, and educating people like yourself who aspire to elevate their lives through the outdoors. So let's get into it. Hi, everyone. Joining me today on the Finding Elevation podcast is Dr. Tracee Metcalfe. Tracee is a dear friend of mine. We met climbing in the Himalayas several years ago. She is a physician and has worked as an expedition doctor on many expeditions. She also is a very accomplished mountaineer and has summited nine of the 14 8,000 meter peaks in the world. So this is a really special conversation and I'm excited to share it with you. We talk about how to get started in mountaineering. We, of course, dig into some common issues and illnesses that we experience in the mountains, as well as tips to avoid them. We talk about what's really going on during acclimatization and then wrap up with a conversation about her upcoming project and how you can support that. So take a listen. I hope you enjoy. Hi, Tracee. I'm so glad you're here. Welcome to the Finding Elevation podcast. So we have been friends for a number of years as climbers, as women in the mountains, and you are also a physician. And I've turned to you many times for medical questions or advice as it relates to mountaineering. So I thought it'd be worthwhile having you on the show so that we could share your knowledge with other people. And also you have some pretty exciting projects in the works. So I wanted to chat about those as well.
Awesome. Yeah, I'm really excited to be here. I'm really honored to be a guest on your podcast.
So we met in 2015, climbing Manaslu. You were the expedition doctor for that expedition. And that was my first 8,000 meter peak. And I had just had a bilateral mastectomy. And I remember being like, shit, she's a doctor. She should know probably what's going on with me. And I think you were so compassionate in that conversation and curious about my story, which I really appreciated. As you know, at that point, that was the first 8,000 meter peak I'd ever been on. So I was very nervous and not sure what my body could do. And we became friends pretty quickly after that.
We did. I remember that very well. And I remember just being honestly quite impressed that, you had undergone that bilateral mastectomy and were in between getting further surgeries and that you had put in the time to train and come try Manaslu. And I was excited to meet you and grateful for our friendship and that we've stayed friends over the years.
How did you get started in the mountains? You live today in Colorado, but you didn't grow up there. So what was the genesis of that for you?
Yeah, I would say that's absolutely right. I grew up outside of Los Angeles, so I was really a beach girl, a valley girl, which is maybe even worse. I was an hour from the beach. But I always was really interested in the mountains, reading books about mountains, any movie, anything like that. Somehow I was drawn to them, even though I hadn't been exposed to them. So much so that when I graduated high school, I didn't have to start UCLA until January. So when I graduated high school, there was just no question in my mind I was going to move to Colorado and do whatever minimum wage job I could do just to be in the mountains until I went to UCLA. So me and my friend packed up my car and we drove to Breckenridge, Colorado. We didn't really have a plan. We found a place to...
How did you know Colorado was where you'd never even been there?
No, I hadn't. No, I just kind of knew that Colorado had a lot of mountains. We both had boys that we were interested in that lived in Colorado. So that was part of it, being fully honest. She had, her boyfriend had moved. He wasn't really her boyfriend. This was a harebrained idea, but it worked out well. So yeah, we packed the car up, we moved, we both got jobs at A&W, flipping burger. It wasn't the best job, but it worked for a little while. Eventually, different things, right? Cleaning houses, delivering pizzas. Yeah. My friend decided she did not like Colorado. So she actually moved back after a couple months, but I loved it. So I stayed. And then I I just knew that I didn't want to go to UCLA. So after I was in Colorado for a few months, I just said, I've got to figure out how to go to college in Colorado, and I'm not going to go to, I went to the UCLA orientation, and it just wasn't for me. It was just, I could just understood that wasn't where I wanted to be. So I ended up applying to Colorado College and starting there the following year, which is in Colorado Springs.
And that was it.
That was it. And then, I can go into basically once I lived in Colorado, I was just in love with skiing, but also hiking. And Colorado has 58 14,000 foot peaks, and they range from easy just walk ups that are 6 miles round trip to 5th class climbs. And so that just provided a way for me to really start with easy mountains and gradually progress to harder mountains. And so that was kind of how I got into climbing mountains.
And did you, because I get this question a lot from people, the question of how to get started. And you obviously had this playground at your disposal all the time that you could test yourself in and learn about the mountains. But was there a mentor that helped you? You had to work up to doing a 5th class climb. Did you join a club that gave you the confidence? Is there someone that you climbed with that was a mentor? How did you make that progression?
That's a good question. I didn't have a mentor per se. I mean, it was a progression over probably 20 years, to be honest, because I was dealing with going to college and then to medical school. And so no, I just with friends would slowly kind of work up from easier ones to harder ones. I did at some point realize I really wanted to try to climb Rainier and Denali. And so I took a course at that point. I went up to Alaska and took a 5-day course to learn crevasse rescue and things like that, which was super helpful. But I would say I just kind of learned hands-on with friends.
Which I think is a great way to learn too. I think some people sometimes overlook that there is a community out there, and we often know somebody, especially in mountainous states. There's usually a group of people that are willing to let you as a newbie tag along and start to learn with them.
Totally. And I think the Colorado Mountain Club, there's definitely a lot of resources here in Colorado for people that are just getting started.
Yep. Same. I really didn't I had some mentors, but I didn't join a club or do anything like that. It just sort of happened over time, I guess, kind of naturally. But so at some point then I love the fact that you took your profession and combined it with your love of the mountains and turned that into a job. So you became an expedition doctor, and we don't really have expedition doctors as much as we used to, unfortunately. But how did you make that transition from I love the mountains, I'm a doctor, I can do these two things together and get paid?
Yeah, it's sort of a funny story. I mean, initially I tried to do more traditional things volunteering with our mountain rescue. And I did that for about a year, but I didn't really they weren't set up to use my medical skills. So, I was doing what anybody who would be volunteering would be doing, which was fine. But I kind of had this interest in applying medicine, using my medical knowledge. So that didn't really work out for me. I did try to see if there was opportunities to work with ski patrol. And I also struggled to find opportunities with that. It was kind of you can volunteer, but they weren't they already had a medical director or things like that. So it was a little random. I was actually up skiing in Alaska, heli skiing, and one of the women guides up there who I really admired, she's also a helicopter pilot, just a complete hardcore badass woman. She said, my husband is one of the rangers on Denali, and he's always looking for medical people. So I feel I got the universe just kind of came together and offered me that opportunity. So I went up there and I worked with them for 30 days on Denali, and then I went back and did it again. So that's kind of how I got started. So there's usually 4 patrols on the mountain, and it's led by a ranger. And then there's one medical person, and then there's usually 2 or 3 volunteers that really know their rope skills. And each patrol is starting at the base and going up to all the way to the summit. And so at any one time on the mountain, there'll be patrols staged at all the different camps if an emergency happens.
I also love it when you have this inkling of a desire, and then these random conversations happen that point you in the direction of actually making that a reality. And it changed the course of your career, I would guess, to know you could combine these things.
Yeah, definitely. I would say it changed the course of my life because being up on Denali, like I said, I think I did it 2 different seasons, getting a chance to summit. Like I just fell in love with that level of mountaineering, like the high altitude, the long expedition. And I really knew that I wanted more climbing and more doing high altitude medicine. I think if that hadn't happened, I'm not sure how I would have broken into that. I think for sure I would have figured out how to keep climbing bigger peaks, but I'm not sure I would have had the opportunity to work as a doctor on them.
What are some of the common issues that you experienced as a doctor in the mountains? And then how can we as mountain athletes avoid those problems?
That's a really good question. Well, kind of break it in. So as you know, I've worked on Denali and then I've worked in the Himalaya on Everest, Manaslu several times, as well as Makalu as an expedition doctor. So you kind of see different things depending on, I would say Alaska and the Himalaya are different in some regards. I would say that on Alaska, like I saw more frostbite, more kind of cold related injuries because it is a cold mountain. I didn't see cough is not super common on Denali. Like in Nepal, people get this thing called the Khumbu cough, and that just doesn't really happen in Alaska. So in Alaska, I would say I saw cold injuries, blisters for sure, like pretty severe blisters, sunburns, like some sunburns, like so bad that, it was requiring medical attention, which is obviously pretty preventable. I mean, not completely preventable, but
Yeah.
and then, well, one thing that I've seen in both places is how to say this right, is basically a butt boil. So it's like,
this on Manaslu.
yes,
This happened. I totally remember, I won't say who it was, who came from a different camp and was like, I need you to look at something. And I remember he being like, and he was so embarrassed.
So embarrassed. So embarrassed.
But let's talk about it.
Well, yeah. So it's like right where, kind of right up above, like between your back and the crease in your butt, like right in that area where your pack kind of rubs. People tend to they'll get like, it's almost like an ingrown hair, but it's much more severe than that. It turns into like a big, sometimes like golf ball size, like deep pimple. And I've actually had to evacuate someone on Denali and someone in Nepal for it. So I'm just thinking out loud. It's always been in men. I've seen 5 of them and they've been in men. I don't know for sure women could get them too. So I'm not sure but I think the way to prevent that in my mind is, having a well-fitting pack, making sure like you're cleaning, kind of good hygiene at the end of the day, just like using a wet wipe, wiping any sweat off from that, any area, your groin, hindsight, anywhere, keeping it kind of dry if it's getting too moist with the powder. And the ones where people had to get evacuated, they were just too embarrassed. And so they didn't come see me soon enough. And so probably it could have been lanced, like putting a sharp instrument in it just to drain it. But because it had gotten so severe, it was like almost to the point where they could have gotten sepsis in their blood. So I would say like trying to keep the area as clean, as dry as you can. And then if something is rubbing, like just don't, it is embarrassing, but we see it all the time as expedition doctors, all sorts of things. Just come in and say like, hey, take a look at this before it gets out of control.
I imagine if you're prone to that, even put some sort of like bandage there preventatively. With that,
I think you could. I mean, I've never tried it, but it would seem to me too that you could like maybe, how we use moleskin on our feet. Totally. That you could maybe raise up the area a little bit on the sides so that like rubbing right there, right in your kind of sacral area. But again, I don't know. I think sometimes, I don't think that's a super common thing. I've seen it a lot, so I mentioned it, but I wouldn't want your listeners to all. But it's just one of those things that if something's like rubbing back there and it feels weird, and you can't examine the area yourself. So just like ask the doctor or a teammate just to be like, hey, this hurts. Like, can you take a look at it and make sure it doesn't look like anything serious is happening?
Self-care is so important.
So important. But I guess some of the other things that I've seen, I mentioned the Khumbu cough. Yeah. And I think in Nepal, that's a complaint I see a lot. And it seems to start on the trek in. As you know, the treks are like very dusty. And there's like yaks kicking up dust and there's yak dung all over the place.
I started calling it pud because it was like a combination of mud and poop. That's a lot of what it is.
It's totally pud. I agree. Love that one. Yeah, the donkeys. I mean, just all sorts of stuff. And
Yeah.
so I think, it kind of starts out your respiratory tract is just trying to clear out that dirt every day. And so you're
Mhm.
making more mucus and you're coughing it up. And then by the time you get to like an altitude of Everest Base Camp or higher, it can become a lot more serious. That's one of those things that I really believe like a buff or some sort of a barrier when you're trekking in,
Yeah.
really just to catch that dust, even though it's uncomfortable to have that thin buff around your face. Like for me, I really think that helps. And it also helps like moisturize the air that you're breathing. So the buff, I would say down low, it's just a barrier to keep the dirt out. And like, I think it's a barrier to keep the germs out too when you go in a tea house. It's not perfect. It's not a medical grade mask, but if it's catching, even 30% of the
Yeah.
germs, it's better than not catching any.
Yep.
And then as you get to like Everest Base Camp, I think when you get to the colder, drier air, it humidifies the air in and just by having it more moist, it's more gentle on your airways. And so that's kind of how you prevent it. That was me going on and on about it. But the Kumbu cough is something I see a lot.
And are you a fan of the air trim masks? So I know a lot of, and I've worn, what do you think about those?
I don't know. They make a lot of sense to me. They totally make sense. I did have one that I was going to use last year on Shishapangma. That's a pretty cold, dry mountain, but I ended up giving it to someone else who there was a couple of us talking about trying to go without oxygen. And I realized it was just too cold for me. I needed to use oxygen. So then I gave the mask to someone else to use. But to me, it makes a lot of sense. I plan on using them this year. I don't know that I would like it's too bulky when you're trekking in. Yeah. What do you think about them? You said
I used one on to Lhotse last year, not trekking to base camp, but once we started climbing. So once we got to about 17 or so thousand feet, I started wearing it. And it's a lot like wearing an oxygen mask, right? It's that kind of profile. So it does, and I have a small face, so it does limit your vision a little bit. But I found that I had much better, just healthier respiratory system when I wore it. And I would kind of get annoyed by it and take it off for a little bit and put it back on. But I figured that was still better than not having anything on the whole time.
Yeah, that makes sense to me. I think especially like I noticed some people are able to wear them all the time. Like I think it's worth buying it and seeing if you can stand it. And if if it doesn't bother you that much,
Yeah.
I think it would be great. For me, I think it will drive me crazy sometimes. So I'll go back to the buff. I think when I can stand to wear it, I'm going to try for sure.
We'll link it in the show notes and people can check it out. So the Kumbu cough by itself, though, can it progress to something more serious like pulmonary edema, or do you find that it generally just stays as that really hacky productive cough?
It generally like stays just as that, but the thing is that it gets more violent as you go up in altitude. So it's not that it's like turning into pneumonia or to high altitude pulmonary edema, but if you can't get rid of it and then you're having to cough so much at high altitude, people end up sometimes breaking a rib because the coughing is so violent that can end their trip. I would never like tell someone that because they had the Kumbu cough, they had to end their trip. I think you can work through it, but I think you just have to be. The thing that I've noticed is, this is Tracee the climber, not Tracee the doctor, is that you really you're doing yourself a disservice if you're coughing too much at high altitude. So like when somebody has that Kumbu cough and then they're just like continually like trying to clear everything out, I think that makes it almost more irritating. Like I think if you can just tell yourself like, it's okay, I feel that tickle, I'm not gonna like have a big coughing fit. I think the climbers that are able to do that, it doesn't disable them as much as people who just keep like trying to cough up a piece of phlegm. But it shouldn't turn into anything more serious. But obviously the higher we go, the drier it gets and our secretions get more kind of, I guess, tenacious is the word I would use. When it's humid, you can like cough a little piece of mucus out. And when it's really dry and you're using an oxygen system, all that kind of extra mucus from the Kumbu cough is going to be harder to cough out. So best to prevent it as much as you can. And I think it's really hard to get rid of it once you're like at Everest Base Camp. Like if you have an opportunity to go lower, be, down at like Namche or somewhere a couple thousand feet lower, you can use, a lot of times people will kick it within a couple days. They'll get rid of the cough, but it's hard to get rid of it.
Agreed. I've even had it Like I've come home and still had it, like remnants of it, very lingering. Well, you mentioned blisters, and I think this is actually a very important topic. Like, obviously, there's a lot of other things that can happen to us in the mountains, but blisters are one of those things that seem benign. Some people don't even think about it, but they can end your trip if you're not taking care of your feet. So you find them more prominently, or found them more prominently on Denali, it sounds like, than in the Himalaya.
Yeah, I mean, I guess that was, well, there was less relative to other things. I was seeing more blisters on Denali, but I was seeing them in both places, if that makes sense. So, but I think I've actually, like, I've seen people's trips get ended because of a blister. It was actually on Denali that there was a woman and she had had a really deep blister on the back of her foot. She didn't want to tell her guide because she was, afraid that they would tell her not to do her rotations. But by the time she came to see me, like, she had cellulitis, which is a skin infection all around the blister. The blister was just so deep, and there was no way, like, that it was, I mean, once it's cellulitis, a skin infection, you need antibiotics, but the body just can't heal at that elevation. I think they're underestimated how severe how they can. For me, prevention, right, obviously is the most important thing. Testing your boots out ahead of time. For me, I know that I have to tape my heels. And so I tape my heels before I trek, before I climb. And if I do get a blister, trying to manage it, not just letting it fester, I guess.
Right. So I love these hacks. What's your favorite tape? What do you like to use?
I love Leukotape. Do you
know?
Do?
Okay. Mm-hmm. Oh, yeah, for sure.
What about you? Do you have a favorite tape?
So I like Leukotape. And then more recently, I've started using Alpine Armor, which is I think, relatively new company started by a woman she used to live here in Seattle. And now I think she's in Utah, but we can link it in the show notes. And I've had several of my clients have used Alpine Armor and really liked it. So it's meant for, obviously, for taping your feet in like a rugged environment. So I'll send you some before you go back to Nepal.
Awesome. Yeah, no, I'll check it out. That's great. What do you think? I love those like blister ampules, the kind of hydrocolloid patches.
Yes. So I will take those one step further because I have very bony ankles, and my 8,000 meter boots still like rub my ankles if I wear them for all day. And so they make those hydrocolloidal patches that are meant for like burn. They're meant, they're meant to like be on your skin for many days. And I will preventatively duct tape those on my ankles because they have a little bit of cushion. I feel like it's okay to leave them on there for an extended period of time, and they prevent that abrasion that would happen otherwise.
Yeah, nice. I have a friend who does that too. Luckily, I just use them after I get a blister, but I think they've been kind of game changers for being able to, like, if you have a big blister on your heel that's ruptured, I love that you can put that on there. I think the key is not to keep peeling it off. Like, once you put it on there, you mentioned something, right? Like, I tape it over with Leukotape then, and I even use sometimes like a sticky adhesive before I put the tape, because if you're pulling the hydrocolloidal patch off each day, you're going to like rip all the healing tissue out. And so you just need to let it stay there until it's ready to come off.
It's like a toenail. You've got to let it decide when it's ready to fall off.
Exactly. Absolutely.
Well, let's talk about just what happens to our bodies at elevation. So, we all have aspirations to climb higher. There's certain physiological changes that occur, some of them great, some of them not so great. So maybe just start with the basics. Like, I live at sea level, you live at 8,000 feet.
Yeah, that's a great question. So yeah, when we go up to and it's funny that you use like my living elevation of 8,000 feet, because that's kind of where we start to define high altitude, even though it's not super high. But when you come here, the first thing that's going to happen is your respiratory rate. Well, because your oxygen is going to drop because there's less oxygen, your respiratory rate's going to go up because your brain is basically going to say, I need oxygen. The tissues need oxygen. So how do we fix this? Well, we fix it by breathing harder. So in the first 24 hours to 7 days, you're breathing much harder to help increase delivery of oxygen to the tissues into your brain. When you do that, you end up blowing off, because you're breathing so much more, you're blowing out so much more CO2. You actually get we call it an alkalosis. So your blood becomes more alkaline. And then the kidneys, because of that, they like things to be perfect, right? They have a very, like our body has a very narrow pH where it's happy. And so if your lungs are going crazy and you're blowing off your CO2, then your kidneys are going to try to compensate. So they start secreting bicarb, which is a base, basically just to compensate so that your pH stays similar. When they do that, when your kidneys start to do that, they start diuresing. So you start dropping a lot of water. So a lot of, usually the first 24 hours at a new altitude, people will pee out a couple liters of water, and that's the kidneys reacting to the increased breathing rate. At the same time that happens, well, part of when you pee out all that water, that actually artificially raises your hematocrit. So then because there's less plasma volume, the percentage of red blood cells is higher, which the experts are not 100% in agreement about like exactly how helpful that is, but you get an artificial increase in your hematocrit. So that's kind of like what happens in the first, like I would call that the acute acclimatization phase. After that, well, and I should say at that same time, right in that first day, your kidneys, as they're peeing out the bicarb, they also are starting to secrete epigen, which is a hormone that increases production of red blood cells. And so your body starts trying to make more red blood cells, but it takes it like 1 to 2 weeks, even sometimes more, to really reach homeostasis with that. The physiologic changes, I was reading a paper recently that when people are exposed to hypoxia from altitude, like there's over 3,000 different genes that get activated. So there's so much. So what I gave was like, like the altitude for dummies, really basic thing, but there's so much more that we don't understand. And there's definitely a couple of research centers that are really studying that, because we just know there's a lot more that goes on. And you've probably noticed, like, one thing I think women get a lot more of is edema. And so for whatever reason, like my eyes get so puffy the first like 48 hours at a new altitude, whole face. And men seem to get it, but not as much. And that hasn't been studied, like why is that happening? Obviously, one of those 3,000 genes is probably changing. So that kind of in a nutshell, that's what happens.
And then there's also, there's the less oxygen available to us when we're at altitude, but the pressure also drops when we're at altitude. And that can cause a whole nother set of physiological changes in us. And some of those can be deadly.
That's right. I'm smiling for a minute here, because whenever I think of the pressure changes, I think of a condition called high altitude flatulence expulsions.
Because that's a real thing.
It's a real thing. I know, right? So I think about that because, this is basically a lot of farting and burping at high altitude. And for me, it's a very real thing. And if you think about, like, if you take your like potatoes, like a sack of potato chips, right, from sea level, and if you've ever like brought it up to altitude, like the thing is so full, it's like ready to burst because the pressure has changed. And so that's what happens, in your colon. And so then all that gas needs to come out, and not deadly, but definitely very, very annoying, uncomfortable, embarrassing if you have a tent mate that you're not, on a level where you could just say, sorry, I'm going to.
Physiological adaptation is out of our control.
That's right. But so as far as, were you wondering like some of the things that can go wrong if you don't?
HAPE and HACE, like that decrease in my understanding is that decrease in pressure can also cause some of those issues to happen where there's.
It's both the decrease in pressure and the decrease in oxygen. So there's kind of like 3 major altitude illnesses. And first one is acute mountain sickness. And that basically a headache, nausea, basically the best way I can explain it is it honestly feels like a bad hangover, right? It just feels like a bad hangover. And, it's not dangerous. Acute mountain sickness is not going to kill someone, but it's an alarm that, like, it's a red flag to you that something, your body's having a little trouble adjusting and pause. Like I would ideally recommend somebody, if they're having a severe headache from that, try to kind of stay put at that altitude for another day until they're feeling better. Sickness is the mildest thing. I would say it's a spectrum. Acute mountain sickness, honestly, the physiology is very similar to what happens with high altitude cerebral edema. And so that's why it's important, because basically that low oxygen in your brain is causing vasodilation in your brain, which causes swelling. And at a minor level, that's a headache. But when it turns to high altitude cerebral edema, it can be life threatening, because then the swelling is getting much more severe and it's impacting your respiratory drive. It impacts the back of your brain, which is where your balance is. So when somebody has high altitude cerebral edema, often they like can't walk in a straight line. If you ask them, it's kind of like you're doing a field sobriety test, like asking them to like touch your finger in their nose, and they can't do it.
I find that they think they feel totally great.
They do.
It's funny sometimes. I've been around people and they were just like laughing, like, oh, I can't walk. I'm like, holy shit, we have to get you down.
Right. And that one, like I said, that's a medical emergency where, I'm going to initiate treatment probably with dexamethasone and a high dose of Diamox right away and try to get them down and give them oxygen if it's available. So the other one I didn't talk about yet is high altitude pulmonary edema, because it's kind of slightly different. So those two are kind of the brain's adaptation or lack thereof to altitude, and high altitude pulmonary edema is when things go wrong in your lungs. And so when the oxygen is low, your lungs have receptors and they can sense that. And so they constrict. The blood vessels to your lungs constrict because they think, I think evolutionarily, like it would be in response not to altitude, but if you had like a damaged part of your lung that wasn't like had pneumonia or something, you would shut that down because your body would know, well, that part's not working. So let's like clench the blood vessels down and let's use the healthy part. The problem at high altitude is all of the lung has low oxygen. So all of it's getting clenched down, and that's increasing the pressure. And that increased pressure can cause fluid then to leak out of the blood vessels and get into the lung tissue. So then you have fluid in there, and then that also makes the oxygen lower. So it's like a vicious cycle that can definitely lead to death quickly. So it's something that has to be taken seriously.
How would someone know if if you have cerebral edema, you're probably ataxic, you can't walk in a straight line, but with pulmonary edema, what are some of those early symptoms?
Yeah. So some of the things that I've seen is, in a group, like if somebody who's always been like, maybe the middle of the pack, walking at one pace, suddenly one day they're just walking much slower. Like for me as a doctor, that's an alarm. That's not, they might just be having a bad day too, but that's one thing. Or as a climber, you're always able to keep up, and now suddenly you can't. One of the hallmarks of it is like being out of breath, even at rest. So if you of course you feel out of breath when you're at like 20,000 feet trying to hike. But if you stop and you just can't catch your breath, like that is to me a very like dangerous sign. Have you had early high altitude?
Yeah, so I'll share I think I maybe had a touch of it in 2017, but I didn't. I descended the next day and it seemed to resolve itself. And I just had a very bad respiratory infection, and that wasn't diagnosed by a doctor. So I don't really know what happened. Last fall, when I climbed Lhotse, we acclimatized normally. I was feeling great. We got to high camp, spent 2 nights there. Maybe we started summiting the second night, and I just felt horrible. Like I, wasn't able to keep up with my team, just like what you were describing. I couldn't catch my breath. I started hallucinating. And when I summited, like we'll talk about discernment in a minute. This is not an example of Lisa's discernment because I just continued on. I just thought I rationalized it as because of COVID, I hadn't been at altitude in like 3 years. I was 3 years older. I told myself I should have trained better, and thought I could just push through it. Like I had to just dig deeper and push through it. And summited, it was like horrendous. My summit photo, I'm just standing there like, please get me out of here. I didn't feel good. Came back down to high camp. and my sat was, I don't remember now what my sat was, alarmingly low. And
Yep.
I could not catch my breath. And so the next day we descended as a team and spent the night at base camp. And then as we were walking out the following day, if we would go up the smallest incline, like a tiny hill, I couldn't keep up with anybody else. I had to stop and catch my breath.
Yeah.
And that's when I was like, something's not right. Like, this just is not how I normally behave at elevation, regardless of training and being older and all that. And so came back home and saw a high altitude doctor, and he said probably it was pulmonary edema. It's hard to say without having an immediate diagnosis. But for me, the signs were just what you said. I like had been performing at a certain level and could no longer perform at that level or maintain that speed. And I couldn't catch my breath no matter what I did.
Yeah. Yeah, that sounds really classic. And you hit on another thing that I hear people say too, is that, they feel better as they're going down, but then even the slightest hill will make them
It was
completely
unbelievable. I was like, I'm acclimatized. How can I not walk up this tiny hill with a little backpack on? It was just unbelievable to me.
Absolutely. Yeah. And I didn't mention, I do love pulse oximeters. I think they have a place in our medical kit and they're a good tool to have. But, our oxygen saturations can vary a lot day to day, depending on if you're sitting versus laying, how deep you're breathing. But I do think that's one of the things that, if you have been satting at for, let's say, 80% at 20,000 feet, and now suddenly you're 65% and you've double checked that your finger's warm. You've double checked, that the device is working properly. That's also that would be a red flag that you might be getting pulmonary edema. And I had a patient that had it on Manaslu, and it was pretty scary. And one of the things I think that's hard as a doctor is that patients tend to feel a lot better once they get down. So I kind of tried to warn the person, he was in agreement that he needed to go down, but by the time he got to base camp, he felt so much better that he was second guessing the decision. But then I did kind of what you had talked about, but I just asked him to walk up a small hill, and then he realized, no, he had made the right decision. But it's one of those things where people get down and then they're like, oh, maybe I overreacted because I feel so much better, because it does get better quickly with descent.
Yeah. And so you as a doc, if you saw that in the mountains, you would treat that with what? If you, or that particular person, how did you treat him aside from telling him to go down?
Right. So that particular person, I treated him with oxygen and had him go down. Luckily we were at Camp 3 on Manaslu, and that's where we had a lot of oxygen tanks staged to be taken to the next camp. So we had enough oxygen, and descent was possible. There are medicines, nifedipine, which is a calcium channel blocker. It basically helps decrease the pressure in your pulmonary arteries. So I was talking about how those blood vessels are constricted. It opens them up. I've honestly never used that one. I carry it in my kit. And if descent and oxygen were not available to me, say when we were there at Manaslu, the weather was so bad and we had no oxygen, and so I couldn't get this guy down, I would have started either nifedipine or sildenafil, which is Viagra, or Cialis. Those all work by decreasing the pulmonary pressure.
Yep.
Get a little nervous. Like I said, I would absolutely use them if I had to. The calcium channel blocker can decrease your blood pressure. So I worry about it in thin young women. I mean, any women, really. Anyone. Now I'm catching myself. I worry about it in anyone, but I tend to notice that thin young women tend to have low blood pressure. And so I would really worry about giving them that and dropping their blood pressure and then having them be so lightheaded that they couldn't descend. So it's not my favorite. I think the Viagras and Cialis are a little bit safer from that regard, but they can cause a headache too. So it's just important to know that if the person gets a headache after you give it to them, it might not mean that they're getting high altitude cerebral edema. It might just be a side effect of the medicine. And honestly, they need to go down. So, these are all temporizing measures, but descent is the treatment. Some people I don't agree with. I know people who have been really focused on a peak or a goal and will sometimes use these tools and keep going. As a physician, I don't recommend that. I think that's dangerous.
Totally agree. What are your thoughts about a much more common medication that's used during acclimatization, and that's Diamox? So most people carry that with them now. Get a lot of questions about whether it should be used and how it should be used. What's your experience?
Yeah, I think it's a great question. I honestly love Diamox. I've used it pretty much on all of my climbs. I was first exposed to it when I was working up on Denali. Of course, I'd read about it and I knew about it. But when I was up there, the rangers were really familiar with using Diamox, and their medical director, she's a woman who runs a big ER in Anchorage, just amazing woman who I have so much respect for, Jennifer Dow. She was really a strong proponent of using Diamox. So the fact that here was kind of my mentor saying it was good, and I knew the studies showed that it was helpful, I was eager to try it. So I used it starting at 14,000 foot camp on Denali. And the dose I use is 125 milligrams, either once a day or twice a day. But I'll take a step back. Basically, the reasons I like Diamox is I think that, we know that it helps people sleep better. So people get this periodic breathing at high altitude. And it's because basically when your oxygen drops below a certain point, then your brain's telling you to breathe more because the oxygen's getting too low. But you also have receptors in your brain that are driven by CO2. So I was telling you how when you're breathing deeply, you're blowing off the CO2. And so basically your brain's kind of having a fight during the night. Should I listen to the oxygen? Should I listen to the CO2? And the result is that climbers get a horrible night's sleep because they pause breathing while the brain's kind of confused whether it should tell you to breathe. And then the oxygen drops low enough that the brain says, breathe. And then you gasp and wake up. And Diamox, people don't know exactly why, but Diamox really attenuates that. So a low dose, even 125 just at night, most people won't have that breathing. And to me, sleep and recovery are so important. And so for, if you're not sleeping at night, you're in there tossing and turning, it's not good for your whole body. So I love Diamox for that purpose. I do think, and we know that Diamox, so basically I should take a step back. The way Diamox works is it augments what your kidneys are doing naturally. So basically it helps your kidneys pee out more bicarbonate, which makes your blood a little bit more acidic, which drives your respiratory drive. So you breathe even deeper than you were breathing before. And consequently, your oxygen saturation goes up. And you can see that when they've done studies at the same altitude, putting someone on Diamox will raise their oxygen saturation several points. So I like it for the sleep. I like it because I just think overall that our bodies are going to be happier with a slightly higher oxygen saturation. Our tissues are going to repair better. Right. So to me, it makes a lot of sense and I'm really comfortable with it. And I've used it, for over 10 years. It does have some side effects, as you know. So, it's a diuretic, so it makes you pee. So for me, I take that evening dose. If I could take it at 3:00 in the afternoon, that would be my ideal time because I don't want to take it at 8:00 when I'm about to go to sleep because then I'm going to be up all night peeing. But I find that the diuretic effect lasts 5 to 6 hours most intensely. Usually the way I do it is when I get to the next camp, then I'll take an afternoon dose, no later than 3:00, sometimes earlier. So that's one side effect, the peeing. Another side effect is the paresthesias, which is tingling in your hands, feet, and mouth. And it's not
nose.
Do you? Yeah. It's not dangerous. And I think as long as you warn people that could happen, I love Diamox. I'm a big fan of it.
So the other question I get, I think you and I have talked about this, is can I start taking it? Let's say I am at base camp on Everest. I feel like I'm not acclimatizing the way I'm used to. So I start taking Diamox. I start to feel better. Even on my rotations, should I stop taking it or should I keep taking it?
Yeah, that's a really good question. So you can definitely stop taking it if you want to. And I think it just kind of depends on there's no hard and fast rule on this. And so I think your example of base camp, at Everest, you start taking it because you don't feel great the first few days. And then, you do a rotation. And so now you've pressed your body to acclimatize even more and you're still taking the Diamox, come down to base camp and you're going to be there for a full week. You can start taking it. That's absolutely safe. And then start taking it again before you go up the mountain. And I do that because, it is a diuretic. And so if I know that I'm going to be at base camp for a week before I'm going to go up, then I'll just stop taking it because I'd rather like not be peeing more than I need to pee and just increase, have my tissues be a little more hydrated. But it's also safe to just take it straight through. Some people get kind of stressed out or anxious about starting and stopping. And although it's safe, it's also safe to just keep taking it.
Really good to know. Well, I could keep talking about all these things, but I want to make sure we talk about what you're up to. So you have some very big goals. So you've climbed 9 8,000 meter peaks, which blows my mind. And you've got some plans for the rest of the summer to climb a few more.
My next project is I have, like you said, I've climbed 9 of the 14 8,000 meter peaks and I have 5 left. So I'm calling it the final 5. So what I have left is Shishapangma, which is in Tibet. And that's the lowest of the 8,000 meter peaks, but it's a very serious mountain. As you know, I was there last year and there was tragedy with 2 avalanches and people getting killed. So it's not, even though people are like, oh, it's the lowest one, it's going to be easy. It's not, no 1,000 meter peak is easy. So I would say it's a tricky peak because of avalanche conditions, as well as it's entirely within Tibet. So getting your Chinese visa and getting permission can be hard. But that's step 1, which I'm really excited about. And then after that, I'm going to go to Lhotse, which is the 4th highest mountain in the world. And it's right next to Everest. I think you and I both had some thoughts of trying to climb it.
Yeah, I think I bought a permit for Lhotse once, but never used it.
I know I wanted to, and then I got talked out of it. But I feel like, I've always known that I wanted to climb Lhotse at some point. I didn't always know I wanted to climb all 14 of the 8,000 meter peaks, but I always knew I wanted to do Lhotse. I just think it's a really aesthetically beautiful peak. I'm excited to hopefully get to the summit and see people summiting Everest and see the views from up there. So that'll be the first, that's kind of like my phase 1 of what I'm doing of my project. And then I have 3 peaks left in Pakistan. And the ones there are Gasherbrum 1, Gasherbrum 2, and then Broad Peak. And I've never been to the Gasherbrums, so I'm really excited. Those are pretty remote. They don't see that as much traffic as, K2 is starting to see a lot of traffic, but they just don't see that much traffic. I think the remoteness will be beautiful. And then Broad Peak, I tried last summer, as you know, but we ended up turning around. We thought that avalanche conditions were a little too serious and there was too much deep snow. And so we decided to save that for a later time. So that's my project.
Well, I am daunted by the idea of doing that many once. And you're raising money as well for girls. Well, tell us about the charity that you're raising money for.
Yeah, absolutely. So it's NGO that's in Pakistan and in Afghanistan. It's called Ascend Leadership Through Athletics. And basically it's run by women and it's teaching women mountain climbing skills. It's like a 2-year program where they'll have a group of 12 girls that go through learning a whole set of mountain climbing skills as well as leadership skills. And the first group of girls is, I think, graduating at the end of this spring, and some of them will then be the leaders to teach the other women. And for me, cool. It just makes so much sense. I got so much of my confidence through athletics. That was especially in a country where girls are not encouraged to do athletics. To me, this program just ticks so many boxes, even though it's kind of a smaller program. I think it's really amazing.
Yeah. And how can people follow along with your journey, or if they want to contribute to Ascend as well, how can they do that?
Absolutely. So I have a fundraiser started for Ascend. Maybe we could put it in the show notes. Do you think that's the best way?
Yeah, we can do that.
And so it's just, a website. It's not GoFundMe. It's called Pledge. It's a different platform. And then I have a website, which is TraceeMetcalfe.com, which we can just put in the show notes, and I'll be keeping that updated. I may be asking you to help me with keeping it updated.
Yes, I'm happy to do it. Well, thank you for joining us. I feel like I learned some things for sure. I'm sure people listening did as well. And hopefully it helps us all be just more confident and more safer when we're out in the mountains. So I appreciate all your expertise, Tracee, and maybe we'll catch up when you're back from your adventure.
Yeah, that would be amazing.
Awesome. Thank you.
Thank you for having me on the podcast. I appreciate it.
Thank you for listening all the way to the end. If nothing else, you can say that you completed one thing today. All of the resources, products, and guest information that we shared can be found in the show notes, so be sure to check those out. You can also find out more about me and what I'm up to at lisaclimbs.com and at alpineathletics.net. And if you enjoyed this show, please subscribe and share it with a friend. Cheers!